What I'm about to tell you might be difficult to hear, but it is absolutely critical. There is a silent enemy hiding in millions of American homes. It's not a thief who climbs through your window, but something you might willingly invite inside every single day, believing it's there to protect you. Imagine that inside your medicine cabinet, right next to the bandages and the aspirin, sits a small pill that, drop by drop, day after day, is placing an extra weight on your heart, a burden it was never designed to carry. You take it to relieve an aching back, to get a little more sleep, or to manage a chronic condition. And all the while, with no fanfare, no chest pain, no warning, the very walls of your heart could be growing thicker. Its electrical rhythm could be getting disturbed, and the pressure in your arteries could be climbing to dangerous levels. I'm Dr. James Howard. In my 35 years as a physician, working across various fronts of healthcare, from the front lines of emergency rooms to following patients for decades, I have seen a tragic pattern repeat itself. People who arrive in my office with heart failure, arrhythmias, or a hypertensive crisis with no idea how they got there. And so often, the root of the problem wasn't a faulty gene or a terrible lifestyle. It was a common medication, prescribed with the best of intentions, but one that carried a hidden risk that no one ever clearly explained. In this video, we are going to count down. I will reveal 7 common categories of medication that could be silently harming your heart. And I promise you, the number 1 on our list is the most shocking, because its side effects disguise themselves perfectly as the normal signs of aging. Stay with me until the very end, because understanding this could be the difference between an active, vibrant retirement and a life limited by shortness of breath and fear. Before we begin, I want to know where you're watching from. Do me a favor and comment below with your city and what time it is where you are. It's a way for us to connect and for me to know who I'm helping today. And if you believe that health is our most precious asset, go ahead and hit that like button for this video so this vital information can reach more people. Let's begin our journey into the medicine cabinet. In the number 7 spot, we have one of the most ubiquitous drugs in the world, non-steroidal anti-inflammatory drugs, or NSAIDs. You know them by names like ibuprofen and naproxen. Who hasn't taken one for a persistent headache, an arthritic joint that won't quit, or that back pain that flares up after a day in the garden? They're effective, they're sold over the counter, and they seem harmless. But for your heart, especially after the age of 60, they can be like pouring salt on an open wound. You see, the way NSAIDs work involves blocking certain enzymes called COX-1 and COX-2. By doing this, they reduce inflammation and pain. The problem is, these same enzymes play a crucial role in protecting your stomach and, more importantly for our conversation, in regulating kidney function and the tone of your blood vessels. When you take an NSAID, especially chronically, you might unknowingly be telling your kidneys to hold on to more sodium and water. Think of your body as a plumbing system. Retaining more water increases the total volume of fluid circulating. It's like trying to force more water through the same pipes. What happens? The pressure goes up. This overloads the heart. It has to pump harder to push that extra volume of blood throughout the body. For a young, strong heart, this might be a temporary challenge. But for a heart that has already worked for 6 or 7 decades, it's an extra strain that can lead to exhaustion. I remember a patient, Mr. Charles, a 68-year-old retired carpenter who loved his craft. He came to me with his ankles so swollen he could barely put on his shoes, and a shortness of breath that kept him from walking to his workshop in the backyard. His tests showed the beginning of heart failure. He didn't drink, didn't smoke, but he was taking high doses of ibuprofen every single day for his arthritis. To him, it was the miracle drug that allowed him to keep working. In reality, it was the silent poison that was drowning his heart in its own fluid. The solution here is not to throw out your anti-inflammatories and live in pain. The solution is awareness. If you use NSAIDs regularly, the first step is to talk to your doctor. Ask, "Doctor, given my heart history, is this the safest medication for me? Is there a lower dose I can use? Are there alternatives like physical therapy, compresses, or other types of painkillers that don't have this effect on my blood pressure?" Don't stop the medication on your own, but start the conversation. That simple question can protect your heart from a dangerous and unnecessary strain. Watch for the signs: swelling in your feet and ankles, unexplained weight gain, increased shortness of breath. They might not just be part of getting older.
That brings us to number 6, and this one is for the millions who are fighting type 2 diabetes. If number 7 was about increasing pressure, number 6 is about the direct accumulation of fluid, a direct threat to the strength of your heart's pump. We're talking about a specific class of diabetes medications called thiazolidinediones. The most common name you might recognize is pioglitazone. These drugs work by making the body's cells more sensitive to insulin, helping to control blood sugar levels, a noble and vital mission. However, they come with a side effect that's in the fine print on the bottle, but that should be in bold, flashing letters for anyone over 60. Fluid retention. They can cause the body to accumulate liquid, which shows up as swelling, especially in the legs and ankles. Sound familiar? It's the same problem NSAIDs can cause, but often more pronounced. Imagine your heart is a sump pump in a basement. Now, imagine a steady rain begins to flood that basement. At first, the pump keeps up, working a little harder, but keeping the floor dry. But if the rain doesn't stop, if the water level keeps rising, the pump gets overwhelmed. It works non-stop, overheats, and eventually, it starts to fail. That is exactly what fluid retention does to your heart. If you already have any underlying cardiac weakness, even if it's undiagnosed, taking a drug like pioglitazone can be the very thing that pushes your heart's pump to the brink of congestive heart failure. I had a patient, Helen, a 72-year-old grandmother whose greatest joy was taking care of her grandkids. She was diagnosed with type 2 diabetes, and her doctor prescribed pioglitazone. Within a few months, she began feeling extreme fatigue. Climbing a flight of stairs left her breathless. She chalked it up to her age and the diabetes. But the truth came out when she woke up one night unable to breathe, feeling like she was drowning. In the emergency room, the diagnosis was clear: acute congestive heart failure, exacerbated by her medication. We switched her to a different class of drug, one that doesn't cause fluid retention, and within weeks she started to feel like herself again. But it was a scare that could have been avoided. If you take pioglitazone or another drug in this class, the message is the same: knowledge is power. Monitor your body. Are you noticing new swelling? Are you gaining weight rapidly without changing your diet? Are you more short of breath than usual? These are not symptoms to ignore. Write them down. Take them to your doctor and ask specifically about the connection between your diabetes medication and these symptoms. There are many other classes of diabetes drugs available today, and one of them may be much safer for your cardiac profile. Remember, the goal is to control your blood sugar without overwhelming your heart. We're getting deeper now. Number 5 on our list is something that affects one of the most basic human functions: sleep. Millions of people, especially as they get older, struggle with insomnia. And to find relief, they turn to sleeping pills, so-called sedative hypnotics. Names like zolpidem or even benzodiazepines like diazepam, which are used for anxiety but also for sleep, are incredibly common. But what they do to your heart while you sleep can be a nightmare. These drugs work by slowing down your central nervous system. That's why they help you fall asleep. They depress brain activity, your breathing, and yes, your heart rate. For most people, this isn't a problem, but for an aging heart or for someone with an underlying condition, this slowdown can be dangerous. And the most sinister risk is tied to a condition called sleep apnea. Sleep apnea is when you stop breathing for short periods during the night. Every time this happens, the oxygen level in your blood plummets and your body panics. The brain sends an emergency signal, releasing stress hormones that cause your blood pressure to skyrocket and your heart to pound, trying to compensate. It's an extreme pressure on the heart, night after night. Now, add a sleeping pill to this equation. The sedative relaxes the muscles in your throat even more, making the apnea worse. It also dulls your brain's response to low oxygen, so you might not wake up as easily when you stop breathing, allowing oxygen levels to drop even further. It is a perfect storm for cardiac disaster. You are, in essence, gagging your heart's own nightly watchman. I remember one particularly frightening case. A gentleman named Robert, 65 years old, came to my clinic for palpitations and dizziness. His local cardiologist was stumped. All his daytime tests were normal. I asked him in detail about his nightly routine. He admitted that he took Zolpidem every night for years. "I can't sleep without it, doc," he said. I suggested a sleep study. The result was shocking. He had severe obstructive sleep apnea, and when the Zolpidem was at its peak effect, his heart rate would drop dangerously low, only to then race, causing the arrhythmias he was feeling the next day. The pill he thought was his savior for sleep was actually orchestrating a nightly assault on his heart.
If you rely on sleeping pills, it's time to have a serious conversation with your doctor about your heart health. First, investigate the root cause of your insomnia. Is it pain, anxiety, poor sleep habits? Second, ask about getting screened for sleep apnea. It is a dangerously underdiagnosed condition. Third, discuss alternatives. Cognitive behavioral therapy for insomnia, or CBTI, is incredibly effective and has no cardiac side effects. Meditation, proper sleep hygiene, and even alternative medications like certain antidepressants at low doses can be safer options. Do not underestimate the danger that hides in a seemingly peaceful but medicated night's sleep. Moving on to number 4, we enter the realm of mental health, which is intrinsically linked to heart health. We're talking about an older class of antidepressants, the tricyclic antidepressants, or TCAs, names like amitriptyline and nortriptyline. While newer, safer antidepressants like SSRIs are more common today, TCAs are still widely used, especially for chronic pain like diabetic neuropathy or fibromyalgia, in addition to depression. The problem with TCAs is that they aren't very selective. They work by altering neurotransmitter levels in the brain to improve mood, but they also affect other systems in the body. For our focus, the most concerning is their effect on the heart's electrical conduction system. Think of your heart as a house with complex electrical wiring. This wiring ensures the chambers of the heart contract in the perfect order and rhythm. Tricyclic antidepressants can interfere with that wiring. They can slow down the electrical signals. This can lead to a dangerous type of arrhythmia, where the heart's rhythm becomes irregular and chaotic. On top of that, they can cause something called orthostatic hypotension. This means that when you stand up quickly, your blood pressure drops dramatically. This can cause dizziness, lightheadedness, and even fainting. For an older person, a fall can be catastrophic, leading to a hip fracture and a cascade of complications. So the risk isn't just the arrhythmia, but also the physical trauma from the side effects. A patient of mine, Mrs. Davis, age 70, was being treated for chronic nerve pain with amitriptyline. She came to see me because she felt constantly dizzy and had fainted twice while getting out of bed. Her previous doctor had told her it was just her pressure dropping, a common thing at her age. But an EKG revealed that the medication was dangerously altering her heart's electrical intervals. She was one step away from a fatal arrhythmia. The dizziness wasn't a mere nuisance. It was her heart's final warning signal.
We switched her to a newer, safer alternative for her pain, and both the dizziness and the EKG abnormalities disappeared. If you are taking a tricyclic antidepressant, especially if it was prescribed many years ago, it is imperative that you review this with your doctor. Ask, is this still the best and safest medication for my condition? Are there newer options with fewer cardiac risks? A simple electrocardiogram, EKG, can assess if the drug is affecting your heart's electrical wiring. Do not accept dizziness and palpitations as a normal part of aging, especially if you're on one of these medications. Be the advocate for your own heart health. We are nearing the top of our list, where the dangers become more acute and common. At number 3, we have something almost everyone uses at some point: decongestants. Pseudoephedrine, phenylephrine, they are the active ingredients in many remedies for the cold, the flu, and allergies. They promise quick relief for a stuffy nose. But what they do to unclog your nose, they do to squeeze your entire circulatory system. Think of your blood vessels as a vast network of flexible hoses. To relieve congestion, these drugs act like someone is pinching those hoses. They cause vasoconstriction, meaning they narrow the blood vessels. This reduces the swelling in your nasal passages, allowing you to breathe better. The problem is, they don't just act on your nose. They act on your entire body. They squeeze the arteries in your arms, your legs, your kidneys, and most importantly, the ones that supply your heart itself. When you squeeze all the hoses, the pump has to work much, much harder to push the same amount of fluid through. Your blood pressure goes up. Your heart is forced to beat harder and faster. For a person with pre-existing high blood pressure, hypertension, which affects the majority of seniors, taking a decongestant is like throwing gasoline on a fire. It can trigger a hypertensive crisis, increase the risk of a stroke or a heart attack. It can cause palpitations so strong you feel your heart hammering in your chest. And because many of these drugs are in cold and flu combination formulas, people take them without even realizing that they're ingesting a potent cardiac stimulant. I treated a patient of mine, Mr. George, age 70, in the emergency room. He came in with a blood pressure of 220/120, a dangerously high level, and chest pain. He was on the verge of a heart attack. The cause? He had a bad cold, and for 3 days had been taking the maximum dose of a popular flu remedy containing pseudoephedrine. He was already being treated for high blood pressure, but he didn't know that his cold medicine was at war with his heart medication. The pill he took to lower his pressure was being canceled out and overwhelmed by the decongestant he took to breathe. It was a battle inside his body, and his heart was losing. The lesson here is crucial. If you have high blood pressure or any heart condition, you must read the labels on everything. Avoid oral decongestants like pseudoephedrine and phenylephrine. Instead, opt for safer alternatives for congestion. Saline nasal sprays, humidifiers, drinking plenty of fluids, or even corticosteroid nasal sprays, which act locally and don't affect blood pressure, are much better options. Always ask the pharmacist, is this safe for someone with high blood pressure? That simple question could save your life. Now for number 2 on our list. This one is insidious because it's one of the most prescribed drugs in the world, taken by millions of people every day for years on end for a seemingly harmless condition: heartburn. We are talking about proton pump inhibitors, or PPIs. You know them as omeprazole, pantoprazole, esomeprazole. They are incredibly effective at reducing stomach acid, and for that, people love them. But long-term use may be silently depleting a mineral that is essential for your heart's rhythm. PPIs work by shutting down the acid pumps in your stomach. Less acid means less reflux and less heartburn. The problem is, stomach acid is crucial for absorbing certain nutrients from your food, most importantly, magnesium. Magnesium isn't just a mineral, it's the spark of life. It's involved in over 300 biochemical reactions in the body. For the heart, it is the conductor of the electrical orchestra. It keeps the heart rhythm steady and regular. It helps relax the walls of the blood vessels, keeping pressure under control. When you take a PPI for years, you can unknowingly be causing a chronic magnesium deficiency. Your body simply can't absorb enough of it from your diet. And what happens when magnesium levels drop? The heart starts to lose its rhythm. You can develop arrhythmias like atrial fibrillation, which dramatically increases your risk of a stroke. A lack of magnesium is also linked to the stiffening of arteries and increased inflammation throughout the cardiovascular system. You're treating your heartburn, but you may be, in the long run, setting the stage for serious heart disease. It's a terrible trade-off that most people don't even know they're making. I had a patient, Mary, 64, who had been on omeprazole for a decade. "It's the only thing that controls my heartburn," she would say. She came to see me for terrible muscle cramps and a fluttering sensation in her chest. Her routine blood work was always normal, but no one had ever ordered a magnesium level. When we did, the result was alarming. It was critically low. The cramps and palpitations were her body screaming for this essential mineral. The PPI was blocking its absorption. We started her on magnesium supplementation and worked with a gastroenterologist to find alternative strategies for her reflux, including dietary changes and different types of medication. It was like turning the power back on in her body. If you have been on a PPI for more than a year, this is a non-negotiable conversation you need to have with your doctor. Ask to have your magnesium levels tested. Discuss whether you still need to be on the current dose or even on the medication at all. Many cases of reflux can be managed with lifestyle changes. The goal should always be to use the lowest effective dose for the shortest possible time. Don't let today's relief from heartburn become tomorrow's cardiac crisis. And as you think about that, if this information is proving valuable, click that subscribe button. My mission here at PrimeAge Health is to give you the knowledge to protect your health. Join our community. And now we have arrived at number 1. The most dangerous medication on our list, not because it's the most potent, but because it is the master of disguise. Its side effects so perfectly mimic the signs we all associate with aging that millions of people, and even doctors, dismiss them. We are talking about a specific class of heart medications, the older calcium channel blockers like verapamil and diltiazem. These drugs are prescribed to treat high blood pressure, chest pain or angina, and arrhythmias. They work by blocking calcium from entering the muscle cells of the heart and blood vessels. Less calcium means the arteries relax, lowering blood pressure, and the heart rate slows down, easing the stress on the heart. In theory, it sounds perfect, but in practice, especially in seniors, they can go too far. They can slow the heart down to a dangerous level, causing bradycardia. And what are the symptoms of an excessively slow heart? Dizziness, especially when standing up, extreme fatigue, a feeling that you have no energy for anything, shortness of breath with minimal exertion, like walking across the room, swelling in the legs and ankles, mental confusion or difficulty concentrating, fainting. Now tell me, doesn't that sound exactly like the list of complaints that many attribute to just getting old? This is where the deadly danger lies. The patient feels tired and says, "I'm getting old." The doctor sees the swelling and may think it's a circulation problem. The dizziness is blamed on low blood pressure. No one connects the dots back to the pill the patient takes every single day. The medication is causing the symptoms, but age is taking the blame.
Let me tell you the story that encapsulates everything we've discussed today. It's the story of a man named Arthur. Arthur was a brilliant engineer, a man who at 78 still read about quantum physics for pleasure.
But over the last 2 years, he had faded. He was diagnosed with high blood pressure and a mild arrhythmia and was put on diltiazem. Slowly, his light went out. He stopped reading because he couldn't concentrate. He stopped taking walks in the park with his wife because he got too tired. He developed constant swelling in his legs that made him uncomfortable. His family watched with sorrow, believing they were witnessing the inevitable decline of age. His doctor said his pressure was well controlled. Arthur's daughter happened to watch a video just like this one. She saw the list of symptoms, and a light bulb went on in her mind. She convinced Arthur to get a second opinion with me. When he walked into my office, I saw a man who was physically present, but whose vitality had been drained. His resting heart rate was 45 beats per minute, far too low. His ankles were swollen. He spoke slowly, as if every word was an effort. I looked at his medication list. There it was, diltiazem. It was a classic textbook case. We did not stop the medication abruptly. That would be dangerous. Working carefully, we transitioned him to a newer, different class of medication, one that would control his blood pressure without slowing his heart so drastically. The process took a few weeks, and then the magic happened. The first thing that came back was his mind. "I can read a whole chapter without getting lost," he told his daughter on the phone, with a joy she hadn't heard in years. Then the energy returned. He started walking again, first around the block, then back to his beloved park. The swelling in his legs vanished. At 79 years old, Arthur didn't get younger. He simply stopped being slowly poisoned. He got back the life that the medication, with the best of intentions, had stolen from him. Arthur wasn't a case of aging. He was a case of masked medication toxicity. Arthur's story is why I created Prime Age Health. It is proof that knowledge is the most powerful tool we have. I am not here to create panic or to tell you to stop your medications. On the contrary, I am here to give you the right questions to ask your doctor. I am here to empower you to be an active partner in your healthcare, not a passive passenger. Your health is far too precious to be completely outsourced. My mission is to help you live a long, healthy, and vibrant life. If that mission resonates with you, I ask for 2 things. First, subscribe to this channel and turn on notifications. There is so much more vital information I need to share with you. Second, think of one person you love, a parent, a grandparent, a friend, someone who might be on one of these medications, feeling tired and old without knowing why. Share this video with them. You could turn on the same light bulb that Arthur's daughter did. It might be the most important act of love you perform today. Keep watching the videos YouTube recommends next. Keep learning, and above all, take good care of your heart. I'm Dr. James Howard, and I'll be here to guide you every step of the way.